Have you ever experienced a stomach bug that seemed to come out of nowhere? Maybe you blamed something you ate, assumed it was food poisoning, or thought it would pass in a day or two. But what if the real cause wasn't a virus or spoiled food, but a microscopic parasite that has quietly spread across more than 31 US states? Most people have never even heard its name. Yet health officials have been tracking it because it can survive in places you would never expect. And once it enters your body, it can trigger explosive diarrhea, severe dehydration, stomach cramps, and symptoms that may last far longer than a typical stomach illness. Here's the frightening part. Many people don't realise they've been infected until days later, after unknowingly exposing family members and others around them. So what exactly is this parasite? How does it spread? And more importantly, how can you protect yourself? Stay with me because one of the biggest myths about this parasite might surprise you. The parasite attracting attention is called Cyclospora, a microscopic organism that infects the small intestine. Unlike bacteria, it doesn't multiply inside your body. Instead, it spreads when contaminated food or water carries its infectious form to another person. What makes Cyclospora particularly challenging is that symptoms usually don't appear immediately. In many cases, they begin about a week after exposure. By then, most people have forgotten what they ate or where they may have picked it up. This delay often makes it difficult to identify the source of an outbreak. The hallmark symptom is severe watery diarrhea. Many patients describe it as sudden, urgent, and relentless. Along with diarrhea, people often experience stomach cramps, bloating, nausea, loss of appetite, fatigue, headaches, and unexpected weight loss. Some individuals recover within a few days, while others continue experiencing symptoms for weeks or even months if the infection isn't properly treated. What makes this parasite especially concerning is that it frequently contaminates fresh produce. Fruits and vegetables that are eaten raw, such as leafy greens, herbs, berries, or other fresh items, can become contaminated before reaching your kitchen. Even people who eat healthy diets may unknowingly consume contaminated food. Another common misconception is that washing produce always eliminates the risk. Unfortunately, that's not always true. Cyclospora has a protective outer shell that allows it to survive many routine washing methods. Although thoroughly rinsing fruits and vegetables is still recommended, washing alone cannot guarantee complete removal. That's why food safety experts focus heavily on preventing contamination before produce reaches grocery stores. People over the age of 50 should pay particular attention. As we age, our immune systems naturally become less efficient. Older adults may lose fluids more quickly during prolonged diarrhea, increasing the risk of dehydration, weakness, dizziness, kidney complications, and hospitalization. Individuals with weakened immune systems may experience even longer and more severe illness. Now here's something many viewers don't know. Unlike many common stomach viruses, Cyclospora infections are usually not spread directly from one sick person to another. The parasite actually requires time outside the human body before it becomes infectious. This means outbreaks are more commonly linked to contaminated food or water rather than casual household contact. However, good hygiene still matters because contaminated environments can contribute to the spread of many gastrointestinal illnesses. So how do doctors diagnose Cyclospora? Unfortunately, it's not always straightforward. Routine stool tests may not automatically detect this parasite. In many cases, healthcare providers must specifically request specialized laboratory testing if Cyclospora infection is suspected. That's one reason why some cases initially go undiagnosed or are mistaken for viral gastroenteritis. Fortunately, once identified, effective treatment is available. Healthcare providers may prescribe antibiotics that specifically target Cyclospora. Most patients improve significantly after appropriate treatment, although recovery times can vary depending on age, overall health, and the severity of dehydration. Equally important is replacing lost fluids and electrolytes. Severe diarrhea can rapidly deplete water, sodium, and potassium, leaving people feeling exhausted and weak. Drinking plenty of fluids and following medical advice becomes especially important for older adults. So how can you lower your risk? Start with proper food safety. Wash fresh produce thoroughly under running water, even if it's labelled pre-washed. Refrigerate perishable foods promptly. Separate raw foods from ready-to-eat items to reduce cross-contamination. Practice careful hand hygiene before preparing meals and after using the restroom. If you're traveling internationally, be cautious with untreated water and uncooked foods, especially in regions experiencing active outbreaks. And perhaps most importantly, don't ignore persistent diarrhea. If symptoms continue for several days, become severe or are accompanied by dehydration, bloody stools, high fever, or significant weakness, seek medical attention promptly. Early diagnosis can shorten illness and reduce complications. Now let's put this into perspective. The fact that this parasite has been identified across multiple states does not mean everyone is at immediate risk or that widespread panic is warranted. Public health agencies continually monitor outbreaks, investigate potential food sources, and work with food producers to reduce contamination. Most people who follow safe food handling practices will never develop Cyclospora infection. Still, awareness remains one of your strongest defenses. Understanding how this parasite spreads allows you to make smarter choices without unnecessary fear. The next time you prepare a salad, enjoy fresh fruit, or purchase produce from the grocery store, remember that simple food safety habits can make a meaningful difference. Because sometimes the smallest organisms are the easiest to overlook, but knowing how to protect yourself may help prevent weeks of illness. If you found this information helpful, subscribe to Dr. Jhon A. Demaria for evidence-based medical education designed to help you make informed health decisions. And remember, staying informed isn't about living in fear, it's about giving yourself the knowledge to stay one step ahead.